Vase, the first time I met Marcus Washington. I was on hour 16 of an 18-hour shift. I'd already intubated 17 patients from a construction site collapse. My hands were shaking from too much adrenaline and not enough sleep. And he showed up in my ICU with a paramedic jacket and the kind of exhaustion that matched mine exactly. My name is Daniel Flores. I'm a paramedic in Houston, Texas, and I've been doing this job for 10 years. 10 years of 3 a.m. calls. 10 years of people dying in my ambulance. 10 years of chest compressions and defibrillator paddles and the specific kind of weight that comes from holding someone's life in your hands while racing toward a hospital that might possibly save them. I'm also a person who's dying, not literally, though some days it feels like that. I'm dying from burnout. From the kind of exhaustion that sleep doesn't fix. From watching people I save end up back on my ambulance 6 months later because they're homeless now, or addicted to painkillers, or just broken in ways that an A can't repair. I'm dying from knowing that I'm good at this job, really good, and that being good at it means I can never leave because people need me, and if I leave, people die, and I can't carry that weight. Thursday started like any other shift. I'd pulled the early morning rotation, 6 a.m. to midnight, which meant I'd been awake since 5 a.m. and by 6 p.m. I was already running on fumes. My partner Chet and I were stationed at Medic Station 7, about 15 minutes from the hospital. We were restocking the ambulance when the call came through. Structure collapse at Harrison Development construction site, dispatch radioed. Multiple patients, potential crushes, mass casualty incident in progress. All units responding. Chet and I were the closest. We were there in 8 minutes. The collapse was worse than the initial report suggested. A scaffolding system had failed 8 stories of metal and concrete, and maybe 15 workers caught in the debris. People were screaming. People were trapped. There was blood everywhere and the specific chaos of too many injuries and not enough medics. I made it to a man with a crushed leg femur compound fracture. Bleeding significant, clear indication of compartment syndrome. I started an IV, called for extraction, began pain management. Chet was working on another patient with a pneumothorax. The fire department was extricating people from the rubble. This was going to be bad. This was going to be hours. 4 hours of field operations. 17 patients extracted. 15 transported to various hospitals. 2 triaged to hospice care at the scene. They weren't going to make it, and we both knew it. By the time I got to the hospital, I'd used every field protocol I knew. I'd made calls that determined whether people lived or died. I was completely empty. Then I got assigned to St. Francis Medical Center's ICU for observation and support. Steve Francis was chaos. Emergency department already at capacity from other incidents. ICU beds filling up with my patients. Medical teams working on intake, stabilization, and triage for incoming. I was supposed to just be there to provide field-to-hospital continuity, to brief the ICU team on what I'd already done for these patients. That's when I saw him, Toga. Strong presence, moving through the chaos like he was built for exactly this level of crisis. He was working in 4-line on one of my patients, the man with the crushed leg. Infection risk sky high, and he was speaking to the patient gently while coordinating with the surgical team. Getting him prepped for emergency surgery, he said to me. He was wearing an ICU badge that said Marcus Washington, RN. He had exhaustion written into every line of his body. You're the paramedic who intubated him? Yeah, I said. He was drowsy when I picked him up, but I got a good airway and he's been stable. Marcus nodded like he'd expected that. Good work. We're moving to pre-op, but I'll follow him. Stay if you need to, or if you want to step back, nobody's going to blame you. You've been in the field for 4 hours. I'll stay, I said, which was a lie. I wanted to collapse. I wanted to go to my car and sleep for 3 days. But this person who'd had a beam crush his leg while he was working, deserved someone to see him through to surgery. You should at least drink some water, Marcus said, not unkindly. You look like you're about to pass out. I'm fine, I lied again. Marcus gave me a look that suggested he'd heard this lie before. Many times. Water, he repeated, and he handed me a bottle from what appeared to be his emergency stash. I'll be back. Surgery is going to be 3 hours minimum. You're going to be here watching all this other chaos. Drink water. He was right. He was also possibly the only person I'd encountered in the last 4 hours who'd acknowledged that I was human and possibly needed to not die in the process of saving other people. The next 8 hours were a nightmare of escalation. 7 more patients came in. 2 went straight to surgery. 3 were critical but stabilizing. 2 didn't make it. I stood in the ICU still in my paramedic gear, covered in someone else's blood and my own sweat, and I watched the controlled chaos of people who dedicated their lives to putting people back together. Around hour 12 of my shift, hour 4 at the hospital, I crashed into a supply closet looking for sterile dressings. I needed about 30 seconds where nobody was asking me questions, where nobody was dying, where I could just breathe. I found Marcus in that supply closet. He was sitting on the floor, leaning against shelving units, his head back against metal. He was alone for maybe 45 seconds and he was just broken. Completely, visibly exhausted to his bones, broken. "Hey," I said quietly. He opened his eyes. "Hey yourself. You need supplies, or are you also hiding?" "Hiding," I admitted, smart. He moved over, and I sat down next to him on the floor of a supply closet in the middle of a mass casualty incident. And we both just sat there for a moment without saying anything. "How long?" he asked. 12 hours, I said. "Started at 6 this morning." "How long have you been doing this?" "This job?" 10 years. He exhaled like that number meant something. "I've been doing this for 6 years. And He paused, looking for words. "I'm not sure I can keep doing it." "The shift?" I asked. "The job," he said. "I became a nurse because I wanted to help people. That part is true. But I didn't know it would consume me. I didn't know that I'd start measuring my worth by how many people I saved instead of how many times I remembered to eat. I didn't know that my relationships would end because nobody can compete with a 36-hour shift. I didn't know that eventually I'd be sitting on a supply closet floor at 32 hours awake, wondering if I'm actually helping or just destroying myself slowly in public. I recognized every word of what he was saying. I'd been saying versions of it for 3 years to therapists and friends and my mother, who kept telling me to quit. "I don't have an answer," I said. "For what it's worth, I know." He looked at me, and in that look was recognition of exactly who I was, someone who'd made the same calculation he was making, who'd chosen the job over sleep, over relationships, over stability, and was now questioning whether that choice was actually noble or just self-destructive. "But," I asked, "but I saw you working today. In the field, intubating patients, making calls that meant someone lived instead of died. And I thought this person is good at something that matters. Even if it's burning him up, at least it's burning him up for a reason." He reached over and took my hand. Just held it. We were in a supply closet surrounded by medical equipment, in the middle of a mass casualty incident. And Marcus Washington held my hand like it was the most important thing he could possibly do in that moment. "I'm Marcus," he said. "Daniel," I replied. "I'm going to kiss you," he said. "Right here in this supply closet, at hour 16 of our respective shifts in the middle of a crisis. Because if I don't do this right now, I'm afraid I'm going to lose my nerve and go back to pretending that this job is sustainable." "It's not sustainable," I said. "I know," he said. And then he kissed me. It tasted like exhaustion and adrenaline and 2 people who'd found each other in the middle of everything falling apart. When he pulled back, his eyes were wet. "I don't know how to fix this," he whispered. "The burnout. The unsustainability. Any of it. Neither do I said. "But maybe," I paused. "Maybe we don't have to figure it out alone." We left the supply closet and went back to work. Because that's what you do in a hospital. You work, you save people. You don't get to collapse just because you've found someone who understands exactly how broken you are. But something shifted around hour 18 of the incident. When the surge had finally stabilized and the ICU was moving into recovery management instead of emergency mode, I ran into Marcus in the break room. He looked destroyed, but he was also looking at me with complete presence. "Are you working tomorrow?" he asked. "Yeah," I said. "Day shift. 6 to 6. I'm here for the next 30 hours, he said. "Double shift, double crisis, because apparently that's what being a nurse means." He paused. "But after I sleep for probably a week, would you want to get coffee?" "Yes," I said. "But not just coffee, no?" No, I stopped, unsure how to say this. I want to figure out if this is real or if we're just two broken people who found each other in a closet during the worst day of our careers. He smiled. And it was the first genuine smile I'd seen him make. Deal. We'll figure it out after I've slept for a week. He came back 3 days later, looking like he'd actually slept and showered and possibly remembered that he was a human being. He took me to a Vietnamese restaurant in Midtown that somehow knew my order, even though it was the first time I'd ever been there. He'd gone ahead of time and asked about me, apparently, which was very him. Tell me something true, he said, as we waited for food. Like what? Like why you do this job when it's killing you? I looked at the food coming out, at Marcus across the table, at the traffic outside the window. My parents came from Mexico. My father worked in construction for 30 years. He had an accident, fell off scaffolding, paralyzed from the waist down. I was 12. We went to the emergency room and we couldn't afford. I paused. The medical system was brutal to us. But there were paramedics and nurses who were kind anyway, who treated us like we mattered even though we couldn't pay. And I decided when I was 12 years old that I was going to be that person for someone else. He listened like I was the only person in the restaurant. I've been doing this job for 10 years because I meant it. I meant that promise to myself. But somewhere around year 8, I started to think that promise meant I had to destroy myself to keep it. That helping people meant I couldn't help myself. That if I took a day off, someone would die and it would be my fault. Would they? He asked. Die? Probably not. There are other paramedics. The system would keep functioning. Then why do you think you have to be the one to carry it? Because I'm good at it, I said. Because I'm the one who thinks about whether people have housing after they're discharged, who calls social services and Medicaid, who actually follows up. So you're good at your job, Marcus said. That doesn't mean you have to kill yourself doing it. I know, I said. Logically, I know this. But emotionally? Emotionally, I think if I stop, I'll have to face the fact that I have no life outside of work. That my apartment is a place I sleep between shifts. That I haven't been in a relationship that lasted more than 3 months because I can't be present for another human being when I'm completely hollowed out. Marcus reached across the table and took my hand. My mother, he said, is a nurse. She's been a nurse for 35 years. She told me something when I was crying about burnout at my kitchen table. She said, "Baby, you can't pour from an empty cup. And if you try, you'll eventually poison the water you're trying to pour." I thought she was being dramatic. But she was right. I was poisoning everything: my relationships, my health, my ability to actually help people, because I was so exhausted I was making mistakes. So what did you do? I asked. I took a step back. I moved to part-time. I'm doing agency nursing now, shifts here, shifts there, but I'm controlling the pace. I'm sleeping. I'm seeing friends. He smiled, available if a paramedic I met in a supply closet during a crisis wants to get coffee with me. Is part-time nursing sustainable? I asked. For me, yes. Will it for you? I don't know. But I know that killing yourself isn't sustainable either. 6 months later, made the switch to part-time paramedic work. I joined an urgent care clinic that needed afternoon coverage 3 days a week. It paid less. It was less dramatic. There were no intubations at midnight or races against death. There was also coffee in the morning. There was availability when Marcus had a day off. There was sleep. There was actual presence in my own life. My mother cried when I told her. I thought you would do this forever, she said. I thought I had to, I replied. Marcus brought me to meet his family. His mother, the nurse with 35 years and still working part-time, hugged me like she'd been waiting for me. His father, who was a mechanical engineer, asked me detailed questions about emergency response protocols. His sisters wanted to know everything about me and Marcus, and how we met in a supply closet. This was apparently hilarious to them. I brought Marcus to meet my family. My mother made tamales. My father, paralyzed but still present, took Marcus to look at the garden he'd been building in raised beds, asking him about his own work, his burnout recovery, what it meant to decide that your life mattered as much as the work you did. Your son is smart, my father told me later. He understands that helping people doesn't mean destroying yourself. That's wisdom I didn't have when I was working in construction. 6 months in, Marcus asked if I wanted to move in together. We found a place in Montrose with a second bedroom that I could use for a home office if I wanted to do freelance medical education or writing, or anything that wasn't paramedic work but was adjacent to it. We had space. We had time. We had a life that extended beyond our jobs. 1 year after the mass casualty incident, on a clear November day, Marcus took me back to St. Francis Medical Center. Not to work, just to visit. We walked through the hospital, through the IQ, past the supply closet where we'd first kissed. "I want to ask you something," he said. When we reached the ICU windows overlooking downtown Houston, he pulled out a ring. Simple, beautiful. Made by a jeweler who specialized in medical-themed pieces, it had a subtle stethoscope pattern worked into the band. "I love you because you stayed in that supply closet with me," he said. "I love you because you were willing to admit that the job was killing you. I love you because you're learning that helping people doesn't require self-destruction. I love you because you're brave enough to change." He extended the ring. "Will you marry me?" "Not as paramedics." "Not as nurses? Just as us?" "Yes," I said. "We got married 6 months later at a small venue in Montrose. My family came." His family came. Some of our coworkers came, both the ones who were still doing full-time emergency medicine and the ones who'd learned to step back like we had. My mother gave a speech about sacrifice and what it actually means. His mother gave a speech about filling your own cup first. My father talked about learning late in life that your body and mind matter as much as your career. We honeymooned by taking a week off work and just being. Sleeping, cooking, walking, existing in our life together instead of racing between emergencies. When we came back, we both returned to work. Part-time. Sustainable. With the knowledge that if we stopped, the world wouldn't end, the system would find other people to do the work. And that was okay. That was actually healthy. On a random Thursday night, about 2 years after we met in that supply closet, we were sitting on our apartment balcony in Montrose, watching the Houston sunset. Marcus was making plans for a garden, inspired by my father. I was reading a novel I'd started 3 months ago and was actually going to finish. "Do you regret it?" Marcus asked. "Cutting back? Going part-time?" "No," I said immediately. "Do you?" "No, I was just wondering if you ever miss the intensity. The adrenaline." "Sometimes," I admitted. "But I don't miss the hollowness. I don't miss being so empty that I couldn't actually be present for the people I loved." He took my hand. "I'm glad we found each other in that supply closet." "Me too," I said. "Even though it was probably the worst possible circumstance." "The best terrible circumstance," he corrected. "Because it forced us to tell the truth about how broken we were. And then we didn't have to be broken alone." We sat there as the sun set over Houston, and I thought about crisis and burnout and what it means to choose yourself sometimes. To say that your life matters. To stop sacrificing the present for some future where you'll finally be enough because you're already enough, and you deserve to actually live. The Endopeleg CCTV timestamp, November 14th, 2028. 1432 security footage from St. Francis Medical Center, ICU corridor. Daniel walks in with coffee in hand, not rushing, not panicked, just present. Marcus is at the nurse's station reviewing charts, part of his shift. Daniel sets a coffee down next to Marcus. They exchange a look, no words, but complete understanding. Both are wearing wedding rings. In the background, the ICU operating normally. In the foreground, two people who learned that showing up for each other matters more than proving yourself through self-destruction.